and gentlemen, welcome to the Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, ladies and gentlemen. Welcome back to the Nutrition Hero Podcast. Dr. Brad Watts sitting in the podcast lab as always. Glad to be here. I want to say thank you to all of our new subscribers, all of our, maybe we should call them legacy subscribers, people that have been around a while. I just want to say thank you. You guys are getting some good traction with the podcast over the last 6 months or so, and I appreciate you sharing these podcasts with your friends and family, other providers. Anything we can do to spread this message of health and healing rather than a message of sickness and disease and an obsession with diagnostics and disease. Man, I'm so excited. So this is all about a viewpoint, and that's really what Nutrition Hero Podcast is a viewpoint, a set of glasses that we're viewing healthcare through. And when you have a viewpoint that talks about health and healing and falling in love with the body's ability to heal itself and how to access that and participate with it, how to harness it, man, you separate yourself in your marketplace because everybody else is obsessed with the disease process, and it's fun. So I appreciate the viewpoint. I appreciate when more and more people are awakening to that viewpoint, and it's like it's been here the whole time, right? It's been here the whole time, and it's amazing. So very cool. So thank you for all of the new subscribers, all of the people that are downloading on iTunes, and thumbs up on YouTube. We appreciate your participation. So share it with somebody that you think can use this podcast. So, all right. Today we're going to be talking about some articles that are coming out of Harvard Medical School. And Harvard Medical School, while they do research, the thing that I appreciate most about them is that they write opinion pieces based on the research. Now, if you're not a subscriber to their news service, I think you should be. So you want to make sure that you find Harvard Health Publishing. Harvard Health Publishing. And what they basically do is once a week, twice a week, they're going to send out articles that are written by their staff medical providers or staff researchers. And I think they've been doing it for a decade at this point, maybe even longer. But this is such a phenomenal resource for you to understand what type of information your patients are getting. It's phenomenal. And so, like any good online newspaper, which is how this started, all of this is divided into conditions, divided into topics, because it's healthcare that's divided into conditions. And it's a phenomenal way to see what makes medicine tick. Harvard, right? Harvard Medical School, like the best of the best. And I just, one of the things I want to do today is I want to show you the lens that they're viewing life through. And we got to ask, is it logical? Is it logical? And so, yes, you get a lot of information that's helpful in practice through this, but you also get exposure to glasses that you don't wear, right? The lenses that you hardly ever put these lenses on, but it's important that you do so you can have some empathy and understand where these people are coming from, and that will expand your ability to help lead patients out of the mess. It's so cool. So cool. So anyway, they have a wide variety of people that write these articles, these opinion pieces, and I just want to give you exposure to 2, maybe 3 if we have time today, on what they look like. Some of them are awesome, and they have interesting takes, and some of them I'm like, you have your head so far up your you-know-what, it's coming out the other side. and so it's fun to see the variety. I like that part, right? So anyway, first one I want to talk about comes from, this was posted on July 6, 2020, and it's from a medical doctor, a contributor to this online newspaper situation. And here's the title: Functional Dyspepsia Causes Treatments and New Directions. So functional dyspepsia is what we're talking about when we describe people that have a stomach ache without a clear cause is how they're going to define it. Stomach ache, heartburn, that type of a situation. Now, I'm going to give you their perspective. I'm going to read a couple of parts of this, but I also want to give you the functional medicine perspective, which I think is the logical medicine perspective, if we can put it that way, and we'll describe that as well. Okay, so as we get into it here, acid reflux, the stomach, and the small intestine is the part of the article that this is under. Okay, so if you're reading this or following along and you found it, the guy's name is Vikram Rangan, MD. He's the contributor here. Okay, so because there's no clear cause for symptoms, treating functional dyspepsia is challenging as well. The first step in treatment is usually to check for bacteria like an H. pylori infection, right? Well, obviously that makes sense. We do that in functional medicine all the time. If H. pylori is present, the person is treated with a course of antibiotics. Very common. For those without H. pylori infection or with symptoms that persist despite elimination of this bacteria, the next step is usually a trial of PPIs, proton pump inhibitors. PPIs, which include omeprazole, Prilosec, Nexium, Prevacid, all of the stuff, suppress the stomach's acid production. We're going to pause right here. In my opinion, it's insane that you jump from a bacteria that could be causing the situation, which is common. H. pylori is one of the most commonly diagnosed infections in the United States today, and it has been for the last 10 years, right? It's insane to jump to, well, let's just suppress your stomach's ability to produce acid, because obviously the body has to be broken, right? And that's the lens, the viewpoint that most medical providers are going to be viewing this through. You have to understand that the body's broken. That's the viewpoint. Interesting. Now, proton pump inhibitors never mind and pay no attention to the fact that they've been connected to cognitive decline, Alzheimer's disease, and a whole bunch of other neurologic conditions over the last 5 years, right? Pay no attention to that. That literature doesn't mean anything. But if you're belchy, you have a stomach ache after you eat food, let's put you on that PPI. That sounds insane, right? And I'm being gentle framing it. And that still sounds insane. So, all right. So here it continues. PPIs may help those patients whose functional dyspepsia symptoms are driven in part by acid reflux disease. Okay. We're going to potentially leave you on a medication that once you're on it, most people don't come off of it, and has been tied to cognitive decline and dementias. Okay? And this is the statement we're going to hang that on. PPIs may help patients whose dyspepsia symptoms are driven in part, may and in part, by acid reflux disease. Oh, my goodness. All right, so this is the standard of care we're talking about here. PPIs may also reduce the concentration of certain inflammatory cells in the duodenum, the first part of the small intestine. Question, why are those inflammatory cells there? Okay, I mean, you got to ask that question. Which may also play a significant role in functional dyspepsia. Okay, this is important. This is important to understand. We're jumping from you're belchy and you have a stomach ache with food. It's not H. pylori infection, so let's suppress your stomach's ability to produce acid. Interesting. Okay. Additionally, here's the brain-gut connection headline. So that ends the acid reflux stomach and small intestine section. Here's the brain-gut connection. TCAs, right, tricyclic antidepressants, are another class of medications that are often used to treat functional dyspepsia. Antidepressants are used to treat functional dyspepsia. In some people, functional dyspepsia is thought to be due to an abnormal brain-gut interaction. Okay, what's making it abnormal is the question. Specifically, it goes on, these individuals may have overactive sensory nerves supplying the GI tract, or abnormal processing of pain by the brain. You guys, this is crazy. This is crazy, all right? They may have overactive sensory nerves. Compared to who and why? Right? Compared to who and why? So, these tricyclic antidepressants, such as amitriptyline, right? I can't get this, all right? These antidepressants are thought to modulate this abnormal brain-gut connection. When used for functional dyspepsia, antidepressants are typically prescribed at a low dose where they do not exert any significant antidepressant effect. Head scratcher. All right. However, a large portion of people with functional dyspepsia also have ongoing anxiety, depression, or other mental conditions. Why? Just going to throw this in there as a question. Could it be that the lifestyle plus the DNA is leading to functional dyspepsia? Okay, your DNA, your set of operating instructions that your body's been coded with, and the lifestyle you're currently living are giving you functional dyspepsia. Could that lifestyle also be driving inflammation that contributes to anxiety, depression, other mental health conditions? Just asking, all right? Asking for a friend. Addressing these conditions, often with the help of a trained psychiatrist or psychologist, can also improve dyspepsia symptoms. Psychological therapy has not been widely studied as the medications for functional dyspepsia, but a small number of studies suggest that psychological interventions, like behavioral therapy, may even be more effective than medication. Right? These interventions are shown to resolve dyspepsia symptoms in 1 out of 3 appropriately selected patients. Okay, so in this paragraph alone, there are like 16 hedge words. May, possibly, could, right? Appropriately selected patients. This is amazing. Okay, it goes on to say, in comparison, even the most effective medical treatments lead to the symptom relief in approximately 1 out of 6 treated individuals. Okay, so all you're telling me is we got to be better than 1 out of 6 on our success rate, and we're above the medical standard for handling dyspepsia. 1 out of 6, okay? And then if we're going to look at psychological therapy as being the thing that is improving the odds of success in this treatment situation even more than the traditional medicine, right? Remember, medical 1 out of 6, psychological 1 out of 3. What that is basically, like if you have a rock in your shoe, it's like training your brain to not feel the rock in your shoe. It doesn't mean you fixed that there's a rock in your shoe. Like, do you understand what I'm saying here, right? Super important. Super important. Okay, so it goes on to say here, recent research suggests that modifying the activity of the vagus nerve, so the connection between the brain and your head and the brain and your gut, vagal nerve, right, via electrical stimulation of the skin of the ear may improve gastric accommodation. Gastric accommodation or stomach accommodation is when your stomach expands to accommodate the volume of the meal that you're eating. Only in America are we going to talk about this. Only in the United States. However, research into this treatment is in its early stages, and its effectiveness in relieving symptoms has not yet been studied in large groups of patients. Okay. Functional dyspepsia remains a significant challenge for patients and physicians alike. It's because we don't use logic. We're trying to have a workaround, so please, nobody change your lifestyle. Some may take comfort that functional dyspepsia is not a dangerous condition in terms of putting patients at increased risk of death, unless we're talking about developing ulcers in the long run, /obesity, continuing to live a lifestyle that's functioning, that's causing functional dyspepsia. You can't tell me that it doesn't put you at an increased risk of death. Amazing. Amazing. So, the bothersome and frequent symptoms remain a source of frustration for many, yet hope does exist for those suffering with the condition, both from the judicious use of existing evidence-based treatments and the potential emergence of novel treatments in the future. What an interesting take. Okay, and it's not just this guy's take. He's speaking on behalf of Harvard Health Publishing, a function of Harvard Medical School. Okay, so get the viewpoint that he's in. Not once did he talk about a lifestyle being combined or customized to match your DNA. Not once. But antidepressants, vagal nerve stimulators, seriously. This is amazing. Okay, proton pump inhibitors, that's even the most amazing part, right? So at the bottom here, okay, I just want to throw this out here. It says, some may take comfort in knowing that dyspepsia is not a dangerous condition in terms of putting patients at increased risk of death, except for those people that get put on PPIs, right? That's well documented in the medical literature. So the fact that the studies haven't shown dyspepsia's connection to death, but they have shown PPI's connection to early death, right? That's semantics at this point. And so you have to throw that out there if you're going to be talking about organizing a quality response to a patient's annoying problem, right? It's annoying for them. Nobody likes to have acid reflux or heartburn, especially if they get scoped from both ends and they're like, well, the doctor like, well, you don't have an ulcer. Okay, great. So what do I have? Right? What do I have? Man, you have, well, we call it in my world, my practice, we call it ECF. You have ECF, right? What's ECF? Eating crappy food. Okay, ECF. You get diagnosed with ECF. So here's the viewpoint that I want you to think about, all right? And we'll compare and contrast a little bit here. But here's the viewpoint. We have a situation where there's no way I'm getting to more articles, I don't think. Not today. But we have a situation where the functional dyspepsia, in the functional medicine viewpoint, you have to look at things, remember, as lifestyle plus your current DNA status equals your health experience. If the health experience is heartburn, dyspepsia, uncomfortableness, gas, bloating, indigestion, etc., you have to go to the equation, what goes into the equation, and change it. You can either add PPIs plus your lifestyle plus your DNA changes the outcome. You can add antidepressants, as this doctor suggested, right? You can add cognitive behavioral therapy so that the dyspepsia doesn't mean as much to you anymore, right? Like, this is for real. I just read you this article from July 6, 2020. This is for real. Or what you can do is you can test, change your lifestyle to match the testing, what the testing shows, so that you have a customized lifestyle that matches your current expression of your DNA, and it changes your functional dyspepsia outcome. Novel idea, I know, right? But understanding that that's work. It's work. And it's not cost effective on the front end. Why? Because you're going to have $500 in testing between blood and whatever else you're doing, stool testing. You're going to have $500 in testing, whereas it costs the patient basically nothing to get put on an antibiotic for H. pylori, to get put on Prilosec, to get put on an antidepressant. It doesn't cost them hardly anything to do that, right? The costs of that type of care are heavily weighted to the end of the patient's life. And at that point, they're probably not seeing this doctor again anyway. So, what does it matter to them? What does it matter? That's the question you have to ask. Now, because I see things through a functional medicine lens, I would rather front weight my healthcare and again, novel idea, avoid all of the trash that comes along with being on antidepressants, PPIs, having to sit in front of the shrink when it comes to, behavioral therapy and changing my response to dyspepsia. Seriously, this is a thing. Okay, so let's talk about dyspepsia. Where does it come from? Okay, so this laid out a very good outline of stomach acid earlier, right? This article did. Now, the parietal cells in the stomach are creating hydrochloric acid, among other things, right? Intrinsic factor, etc. But parietal cells are creating hydrochloric acid. This hydrochloric acid is supposed to help you break down food and move it into the duodenum so that the duodenum can then facilitate further enzymatic activity into the small intestine. Okay, so see where you are on the map. All right, just get that viewpoint, and if you have to, Google stomach, duodenum, etc., and so that you get an image of the digestive system here. Okay, the digestive, easy for me to say, digestive system. Get that organized. When we look at what happens in people that have significant dyspepsia, let's just say any dyspepsia, they very well could have an ulcer, right? Food, infections, H. pylori, one of the leading causes of ulcer, right, in people, especially adults. Huge, okay? They could have an ulcer. Changing your lifestyle has to be part of figuring out, how do I stop having ulcers? Hopefully that's not new information to anybody. Hopefully that's not like, the cloud lifted and all of a sudden I figured out that ulcers come from my lifestyle. Hopefully that's not new, right? So I get that, and I agree with the H. pylori. Sometimes you got to have antibiotics. Sometimes you have to have antimicrobial herbs, if that's your style, which, that's my style. Sometimes you have to have those antimicrobials to take care of whatever the infection situation is. But let's say you don't have H. pylori. Let's say you don't have an ulcer. You just have dyspepsia. And where's that coming from? Okay? So the thought is, your stomach's overproducing acid, so parietal cells are overfunctioning. I have seen that happen. But in all of my years in functional medicine, in the thousands of cases that I've been, blessed to be a part of, all of my years, I've seen parietal cells go rogue maybe a handful of times. Maybe. Usually, parietal cells are producing hydrochloric acid in response to the food that's being put in. Your body's super intelligent, right? Usually, parietal cells are producing acid in response to the food that's getting put in. So if you condition them to digest something like green grapes, you eat green grapes every day for like 2 weeks, right? You will change the acid output of your body because your body becomes conditioned to the food you're eating. Now, if you eat like the only meat diet, you've seen that one, and you're just eating steak every day for a few weeks, you will condition your body's acid output to match the food you're putting in. Like, hopefully this is not a novel idea either, right? Hopefully this is something where you go, well, yeah, duh, Dr. Watts, of course that happens. The body is intelligent. It adapts to the environment, okay? Now, what if your environment is loaded with sugar? What if your environment, the lifestyle, is loaded with grain? So here's what happens. There's 2 types of acid in the stomach. You have organic acid that your stomach is producing. You have inorganic acid that's coming from the food you're eating. So let's say you're eating terrible food that's been processed, food that's been changed, food that has been dilapidated from its normal intended structure, right? Food that sits on a shelf for a long period of time without rotting, that kind of food. Let's say you're accustomed to eating that, right? Not just, oh yeah, I had Wendy's this week for the first time in 6 months. No. I'm talking like this is your lifestyle. The Wonder Bread bagged food in a wrapper, single serving lifestyle, okay? This food, which is the standard American diet, people are typically eating this type of stuff because it lasts for a long time. It's cheap. And quite frankly, it tastes good. You're eating this food that's not compatible with the digestive profile that you have. The enzymes you produce, the acid you produce is not compatible with the food you're eating. Okay, get that first. That food sits in your belly, and because it doesn't digest fast enough, it rots. That food rots. It produces its own acid, which then gives you heartburn, the dyspepsia, right? It gives you that dyspepsia, and you start belching and all this stuff. That food is supposed to be moving into the duodenum and then into the small intestine and then into the large intestine and then out the tailpipe, right? That food is rotting in your stomach, leading to the belching and all the other stuff. When it gets into the small intestine and then further down the digestive tract, that rotting, that it's no longer belching, it's flatulence. See what's happening here, okay? If you're eating food that's not compatible with your digestive profile, you are driving an induced dyspepsia. Not because your body is broken, it's because your diet's broken. Your diet's broken. Like, is it any wonder that medicine will do anything to help you? Anything except getting rid of the root cause of the problem. Don't get rid of the root cause of the problem, because now there's no longer a problem that we have a solution for. Okay? But they'll do anything to help you with the fruit of the problem. This is amazing. So you have two types of acid. You have the acid produced by your parietal cells, which is almost never overproducing. Like I said, a handful of times in my entire career have I actually seen that. Almost never. Usually what's happening is the acid that's causing the indigestion is coming from the food not being broken down fast enough and moved through the digestive tract the way it's supposed to be. Right? So this is a lifestyle-based issue for, if I had to take a guess, 9.7 out of 10 cases. Right? Lifestyle related. Absolutely. So amazing. And I even looking at it in this article from Harvard Health Publishing, it gets me. It gets me. So, and there's so many, they have such a strong effect on the population, Harvard Medical School, and on the physicians that they train. Such a strong effect that nobody's looking at this and saying maybe you shouldn't eat grain. Maybe you shouldn't be eating steak. Maybe your body's a fan of chicken. Right? And they go, well, I had chicken for lunch yesterday and that didn't change it. Well, no, it's because we got to put the food in consistently so your body adapts to the food you're eating and magically your heartburn goes away. But guess what? Tums works within 60 minutes. That's the reality that we're living in. Tums works in 60 minutes. Cognitive decline, that's 40 years away. Right? But Tums works in 60 minutes. Why would I do something that causes my body to adapt and change over a 2-week period and then my heartburn goes away? It's logic, right? Logic. Sometimes logic lands like a pine cone enema. And it's something that needs to, I think, play a larger role in healthcare today. Logic. And so sometimes people ask, what do you do? Well, I'm in healthcare. What kind of healthcare? Logic. That's what I'm into. Right? And that's really what this is about. So anyway, get on Harvard Health Publishing. Get on the Harvard Medical School distribution here of this type of information. It's just a newsletter. Get on it. They have a huge database of articles like this, and it's stunning. I'm going to link to this one, I think, in the podcast notes below. So you have it if you want to read about it, if you want to see the glasses that medicine is wearing and understand the difference between you and them. Hopefully the difference between you and them is logic and work, right? A little elbow grease. It's work to change your diet. But your body will reward you. I think that's where we're going to leave it. I think we're going to be done here today. Thank you for following along with the Nutrition Hero podcast. I'll catch you next time.